1.
Hey guys, I'm Dr. Allen with Pro Chiropractic, and today I'm going to show a treatment protocol for hip impingement or femoroacetabular impingement. What can happen with hip impingement is the femur comes into the acetabular or your hip bone here, and there can be a bony outgrowth on one of those two surfaces. Often it's a combination of both, and when we do a specific motion that I'm going to show here in a second, those two bones pinch on each other and they cause a specific pain in the front of the hip and often radiating to the groin or like around to the lower back as well, or kind of like the posterior hip, back of the hip there. And then so that's what I'm going to show here, and then we're going to show a little bit of a treatment protocol for it. Okay, so the test for hip impingement is I have to take it into flexion, abduction, and internal rotation. Basically fancy terms for what I'm about to show. So I'm going to go up here. Any pain with that, Gina? A little bit there. And then I'm going to adductor this way, and then we internally rotate. And that's where Gina has the most pain in the front of the hip, and it radiates a little bit into the groin. So that's how we know we have at least a little bit of hip impingement. And when I say hip impingement, that doesn't mean a life sentence for pain or dysfunction. It's just something we have to manage. We need to optimize the muscular function around that joint so that when she works out and she does her daily activity, she doesn't have pain and she has good joint stability. So, of course, I've gone through the adjustments that we need to do for the lower back, the hip, the lower extremity as well. I'm going to show the exercises that we do in here and then also to be done at home. So, Gina, lay on your left side for me. Bend your bottom knee here. So I'm going to roll your hips forward and backwards, and you're going to start with really good pressure in your belly. So what I'm going to do with this is we're going to take the hip and we're going to move it into internal external rotation and adduction, abduction, and also the muscles of the back of the hip here, the glute muscles. We're going to elongate those, and then she's going to activate them against pressure, and we're just going to work back and forth. It's an eccentric activation of these muscles that'll help relax everything and lengthen everything, stretch it out. So start with really good pressure in your belly. Don't let me lift your knee. And then we're going to roll forwards here. Good. Now push back into me. Keep pushing, keep pushing, keep pushing. Good. Keep a little resistance. Will let me win. And push back into me. Keep a little resistance. Couple more here. Push back into me. Good. Keep a little resistance. Let's do one more here. Push back into me, and then keep a little resistance. Perfect, and then come up onto your forearm. Knees here. And then this is called DNS Side Bridge, so I'm going to go through and show how we do this. With your elbow, lightly press the table away. And then with your knees, you're going to use them as your support and bring your hips straight up in the air. Good. Arms going to be parallel here. Look down and tuck your chin. And then I'm going to bring your top leg up just a little bit. Hold right there. So we have arm and leg parallel. Pressurize your belly here. The hips just a touch higher. And now don't let me move you backwards. Good. So this is challenging this transitional position. It's forcing her to stabilize with her hip and her core, as well as her shoulder. That's not the main goal right now, mostly her hip and her core, but the shoulder component is in there as well. So what we typically do with this is a 20-second hold, and then after the 20-second hold, we'll do 3 repetitions of slowly moving down and back up. So slowly come down, but don't rest, and then right back up. Good, 2 more of those really slow on the way down. Perfect. And that's for eccentric strengthening of those downside gluteal muscles. Okay, and then totally relax for me. And then lay on your back. And then we'll go in and retest that same test to see if it's still pinching. And it may still be pinching a little bit, but what we look for is a little bit of relief. And then in between visits, of course, there's going to be a little bit of consistency of care. Very rarely is something an instant fix, but of course we want to go in and retest this. So into flexion, adduction into rotation, pinching a little bit, just a touch. Okay. Perfect. And then what I'm going to have her do at home is that side bridge. We'll educate that to be done at home, and I'll send her a video of it as well. But then a hip flexor stretch. So come on up for me here, Gina. And then you can stand right over there for me. So I'm going to show it first, and then I'll show her how to do it. So basically, it's going to be here right leg. So you're going to go in this fencer stance, and arms up just for like balance, basically. And then you're going to lunge forward like this, keeping your back leg straight. So you'll do a set of like 10 to 15 of those for the sagittal plane motion of this muscle. And then you'll do a set of 10 of moving forward and then pushing your hips off to the side of the hip you're working on. So off to the right in this case. And that works the more lateral components of the hip and those musculatures. So show me one set of that for me.
Okay.
Try and keep your heel down too.
Okay.
Yeah, perfect. So you'll do about a set of 10 of those, and now show the lateral one. So come forward and then push off to the right. That's perfect. So you'll do about 3 sets of 15 of those throughout your day, both components of that, just the forward motion and then the side motion as well. So that's our soft tissue and exercise protocol for hip impingement. I neglected to show the adjustments, but we'll do another video for that as well. But that's everything that we put together for hip impingement to be done in the office and at home. Stay tuned for plenty of other videos. And again, I'm Dr. Allen with Pro Chiropractic.